All right, good morning. See, there's one breakout session from the 10 a.m. that maybe will be coming in, but for the respecting everyone's time and making sure we maximize the time the presenters have, let's go ahead and get started. So welcome. You're in the session entitled Uniting and Advocating for Today's Student, Removing Barriers and Addressing the Mental Health Crisis in Schools. I will be your room monitor. I'm Stephanie DePalmer. I will let the presenters introduce themselves in a few minutes, but before the presentation starts, I would like to remind attendees of a few important points. This session will be 50 minutes. We will be offering CEs for those who registered with a CE option. We are required by NBCC to take attendance and verify those requesting CEs attended. This means that you will need to keep your video on for the vast majority of the presentation. Thanks for understanding. We will have captions on and be recording the sessions. Please keep this in mind when it comes to making comments. And I'm here to help you if you have any questions or issues during the presentation. However, if the question is related to the presentation itself, please express this to our amazing presenters. So with that, welcome and let's settle in.
Hello, everyone. Welcome. I'm just going to get my slideshow here up and running. We're so happy to have all of you here today with us. So we're looking forward to a great presentation, and we're also looking forward to hearing a little bit from all of you as well. So as Stephanie had mentioned, our title is Uniting and Advocating for Today's Student, Removing Those Barriers and Addressing the Mental Health Crisis in Schools. So we'd like to take a moment before we get started and introduce ourselves as the presenters, and also hear a little bit about who all of you are and your background. So I'll introduce myself first. My name is Julie Cerrito, and I am a counselor educator at Commonwealth University of Pennsylvania. I am on the Bloomsburg campus. So prior to moving into my role as a counselor educator, I served as a school counselor for 12 years in Pennsylvania public school districts. And this is also my 12th year as a counselor educator. So it's my 5th year here at the Commonwealth campus, but my 12th year total. So it's been 24 years since I've started on the journey to becoming a counselor, and I've enjoyed every moment of it. And I'm looking forward to sharing a little bit about what I've learned with all of you today. And so I'd like to introduce Ashley Paycheck next. Ashley, do you want to, well, you could introduce yourself. Go ahead.
Oh, I know. Tell my spill. Tell my spill. Hi, everyone. I'm really excited to be here and get to experience the next hour with you. Again, my name is Dr. Ashley Paycheck. A lot of students call me Dr. P. I have started with Lock Haven, the CMHC program back in fall of 2019, but I've been teaching in online K-CREP accredited programs since spring of 2015. I've been licensed. I come to you from Colorado, so I'm a licensed professional counselor in Colorado. I wore all sorts of hats at that time, worked in different kind of settings, from residential treatment, doing individual group counseling, family counseling. I was a site supervisor when I was there. I became an administrator and a supervisor. I've also worked in an inpatient hospital, and I worked as a military and family life counselor in an elementary. So that's really where my interests and passion really came into. Here in Colorado, you have to be a licensed school counselor to be a school counselor or a social worker. And so I found my foothold into working in the school system through a private agency that had a contract with the Department of Defense. So I was in the school, elementary, able to work specifically with military kids and families. So that's really where my interest and my passion comes on this particular topic. But it's so nice to meet you all. Dr. Hirschberger, did you want to introduce yourself next?
Hi, everybody. My name is Ashley Hirschberger. I am a clinical and mental health counselor in the community in rural Pennsylvania. I have experience teaching counselor education through Walden University and previously Commonwealth University in the CMHC program. And my experience has varied. I've worked interned in the school setting in a clinical and mental health role. But most recently, my focus is clinical mental health counseling for a variety of ages, elementary, adolescent, and adulthood. So I have the experience of working with students in school, parents kind of trying to support their kiddos. And I've really enjoyed trying to help transition some of the challenges we see with mental health and just building up in stages of life. So it's a pleasure to be working with all of you. Caitlin, who would you like to introduce yourself next?
Sure, thank you. Hi, I'm Caitlin. I'm a student at in the CMHC program here at the Lock Haven campus of Commonwealth U, and I've just had a passion for working with kids with mental health. It started when I was in high school, and we actually had a volunteer project where we were able to work in the library, both over the summer and during the school year, and it was really impactful for me to see how to best help students become their best selves and be able to overcome things like poverty and trauma, and that's kind of where I got my start.
Thank you, Caitlin, and thank you all of our presenters. So we'd like to take a moment and hear from our audience. And so if you would just put in the chat what your current role is, whether that's a student or if you're a supervisor or a counselor educator, maybe a school counselor or clinical mental health counselor, if you could just take a moment and put that in the chat. We just want to kind of get a feel for who our audience is today, so we can kind of gear some of the things we say to the folks that are in the room. So we'll give you just a minute to put that in the chat. So it looks like we have some students, second semester, site supervisor, mental health and substance use counselor, school counselor who's in practicum. Hi, Wendy. An LPC. Hi, Abby. Lisa's a faculty member. We have a doc student. How nice, Brandon. Brandon, where are you a doc student at?
I'm at Indiana University of Pennsylvania.
Excellent, welcome. First year CMHC student, welcome. We have some really nice diversity. So Abby also says has worked in schools, more site supervisors. Yeah, and the director of career and professional development at Commonwealth Lock Haven. Well, welcome everyone. Thank you so much for taking a moment just to share a little bit about who you are. It's always fun to know who's in our audience and a little bit about their background. So we appreciate you taking a moment to do that. So we'll talk a little bit about the description. So all of you have read this, I'll go over it briefly. We all know that there is this mental health crisis in schools. We read about it. It's all over the news. It's really something that we are trying to grapple with, whether you are working on the side of school counseling or on the side of clinical mental health counseling. We know that children and adolescents have a significant number of unmet mental health needs that pose barriers to their learning, that pose barriers to their emotional and social well-being, among other things. And we also know that a significant number of children and youth have an identified need for mental health services, but only a small percentage of them are actually receiving help for those services. So in this presentation, our hope is to talk about how we can collaborate between clinical mental health counselors and school counselors so that we can more ethically and efficiently meet the needs of all of our students.
So continuing with what Julie shared with the program description, just honing in a little bit further on those objectives, we're looking at articulating the impact of the youth mental health, specifically on academic development within the school settings. So we have some research that helps back some of the objectives that we're working with and developing a framework for creating and sustaining that equitable mental health. So we're identifying that this is present, it's a concern. How are we going to continue to help and support our community? We're also going to generate ideas for how clinical mental health counselors can work with school counselors to address these concerns. So we're looking at a variety of systems, elementary, elementary level, middle school, high school, and then moving into college level as well. How do we support our students? How do we support the therapists that are working with everyone to build a change in the mental health struggles?
It's a great point, Ashley, because we're really looking at K-16 then essentially, right? So those, you know, kindergarten through 12th grade years, and then that transition, because we know that that's a hard one as students oftentimes will move into college campuses and kind of deal with a new transition that they have and all that comes with that.
Yeah, definitely. And I love that. I don't know, Julie, if I hear that often. I think you said K through 16.
Uh-huh.
I'm going to start referring to it that way instead of K through 12, because I think that's a really important point. So what we're going to do now is just consider what counselors are we really thinking about? And Ashley's kind of touched on that. I know Julie has as well. So looking specifically at clinical mental health counselors. So these are counselors, and you probably all know this, that are trained and they're licensed to provide counseling services to a wide variety of clients. They also help address a wide variety of issues and work in all different kinds of settings. So some of those settings, or some of the examples of the work that they can do with clients is addressing the emotional or behavioral related issues. Again, this could be things like helping a client work through grief and loss. It could be helping a kid learn how to manage and express their feelings, or perhaps like their anger. Counselors are also, they also work either individually or in groups with marital or relational issues. So I think we always think of marital counseling. That's always two, and it generally is, but we also do some work on the front end individually with one of those individuals who are part of that couple. Clinical mental health counselors, we're trained to work with all sorts of things like career-related goals, jobs, school, education, self-care. The topics that we help address are really endless. We really are prepared to help support our clients with anything that they bring to us, I think. So in addition to those different topics, there's all types of settings. And I'll be the first one I mentioned before. In Colorado, I had a hard time figuring out, how do I work in a hospital? I want to get that experience. How do I work in a school? Because what they wanted was social workers, or here in Colorado, or they wanted, like in the schools, social workers or school counselors. And so I found a couple loopholes on how to do that. And that was more through the private route to get my foot in the door. But some of those places are private practices, whether that's a group practice perhaps, or just one counselor who owns their own practice. I know that we have some of those in our room today. Could be community mental health agencies, perhaps hospitals, whether that's like a medical hospital or a mental health hospital, doing inpatient, IOP, a substance abuse center, whether that's inpatient or outpatient, working with our military. Like I had mentioned, my experience with private agencies or through the Department of Defense as perhaps a civilian counselor. Could be integrated behavioral health, the legal department, and as some of us have shared, we wore the hat of being a counselor in a school as well, just not as a school counselor. So there's a lot of others in addition, but as you can see, the clinical mental health counselors can really work in a lot of different settings with all types of clients. Julie?
Great, thank you, Ashley. So we'll contrast that to school counselor, and you'll notice some similarities and of course some differences. But school counselors are really looking to create comprehensive school counseling programs that are based upon our national framework, which we are governed by the American School Counselor Association. And the American School Counselor Association says that kind of has this picture of a diamond, and there's 4 different areas, and they are listed as define, manage, deliver, and assess. So those are kind of what we're really focused on in order to help school counselors develop and implement and then assess their school counseling program in order to improve student outcomes. So specifically, we're looking at how are students different as a result of the services that we provide as school counselors. So in addition to those 4 different areas that are kind of part of that diamond picture, there are also different domain areas specifically that we work within. And so we are focused on first the academic domain, because they're in school, and so their primary focus is on learning and that education piece. And also the social emotional, because as many of you know, our students are coming in with so many different issues that are impacting their academic learning that we have to kind of sort through and work through with them in order for them to be better learners. And then finally, that career component. So career development really starts in elementary school. And so we begin working proactively with students as early as pre-kindergarten, helping them, understand who they are and what their preferences are, what their skills, abilities, and talents are, so that they could find outlets for those as they move across those years from kindergarten all the way through when they graduate in 12th grade, and then make some of those harder decisions in terms of whether or not they want to go to a 4-year school, a 2-year school, if they want to do an apprenticeship, if they want to enter the world of work. So some of those tough decisions that come as they're transitioning out of high school and into their college years or career years, work years. So that's really what we're focused on. And so as school counselors, typically you will find them working at elementary schools, middle schools, or high schools. They also could work sometimes in college and university settings, not necessarily as a school counselor per se. They have the background in school counseling, but I have had students who have worked in the college setting as well, whether that's in a career development office or, in the counseling center doing something. So really looking at that expertise PK through 16, even though specifically we're focused only on those up to grade 12, if we're looking at kind of traditionally what's happening in school settings across most of our country. So that's a little bit about the background between the two, across the two. I will say that I know when I started in this profession, there was a movement away from addressing mental health concerns. We're not mental health counselors, we're school counselors, and we focus on these domain areas. And the American School Counselor Association really kind of held to that, of how we were different. And then COVID-19 happened. And we are finding that our students are coming in now more than ever, with some of the things that happen, losses that they experienced, loss of learning, loss of family members. And they're coming in with such mental health concerns that school counselors can no longer draw a line in the sand and say, oh, we're only here for the academics or the, social emotional or the career pieces. And oftentimes they find themselves moving into working with students who have mental health concerns, because if not them, then who is the question? And we'll talk about some of those barriers, because they certainly exist. And although we'd love our students to be out there, working with clinical mental health counselors in the community, sometimes it's not always possible. So the next best thing is try as we might as school counselors to work with these students where they're at in the confines of the school day. So we'll talk a little bit more about those barriers in just a moment.
So the next portion focuses on, as we've identified the different roles, similarities and differences, and how we can benefit the individual needs of a client. Looking at the role of a clinical and mental health counselor, granted this varies based on state, what you are capable of engaging in as far as clinical and mental health counseling, LPC work, assessments, etc. But overall, when we're looking at clinical and mental health counseling, we're looking at implementing a variety of techniques, methods, and approaches to work with clients through their presenting concerns when they come to us for counseling, no matter the setting that they present in. And granted, as I said, the states vary based on what, say, assessments you might be able to implement with clients, or diagnoses or treatment modalities that you can and cannot implement. But if we're reviewing like APA standards, we were at the ACA standards, we're looking at the best approach to treatment, the best approach to care, to work through presenting concerns, diagnoses, and that's primarily done through treatment planning. What types of goals you might set in place with your clients, what types of symptoms they might want to work through, but kind of piloting a plan to work through presenting issues.
Thanks, Ashley. So in terms of the role of the school counselor, we are looking to improve student success by implementing both direct and indirect services to students in those domain areas of academic, social, emotional, and career development. And one of the things I'll say about school counselors is that we really try to be proactive and preventative in our role. So certainly we will meet with students that are in crisis or are, presenting with a significant concern and come to us. But in addition to those students, we're also trying to prevent problems from occurring in the first place. So there is that proactive and preventative component where we might be doing some groups, and not necessarily that students are struggling, but we're trying to address things like social skills, if that might be an area, or study skills or test taking skills or something related to that academic component. So I think that's one of the things that we may be a little different in terms that, I think with clinical mental health counselors, they can see clients who, are just looking for overall wellness. But probably more often they're seeing clients that really need help right then and there, where in the schools, we work with all students, not just the students that are struggling, although some days it probably feels like we're only working with the students that are struggling because there's so many of them. But if we look back to our history and our role, it really says that we are a counselor for all students. So the students who are functioning very high academically, students who are functioning low academically, the ones in between, the ones that are college bound, the ones that are going to enter the worlds of work. So really being able to see students across all different types of concerns and kind of meeting them where they're at.
Yeah, I think that's a great point, Julie, because I think of the different roles that I've been in as a clinical mental health counselor, with the exception of working in the school where I also did preventative groups for all types of students, in addition to the military students. I think a lot of what my experience has been more of that reactive, or like after something has happened. Not always, but often.
Mhm.
So looking a little bit about the caseloads, and this is probably no surprise to anyone in the room, for clinical mental health, this really just varies based on the type of service that we're providing and the setting. So for example, when I did residential treatment, and I've shared this with students, they're like, ooh, I would love a caseload of eight clients. I had a caseload of 8 clients at times, or fewer if I was doing more groups. But again, the services were so much more intense in some ways than when I did community mental health in my master's program or some of the other roles. And obviously, you think about if you work in inpatient or if you work in a hospital, you're probably seeing larger amount of clients or patients, depending on the terminology that they use in each of those settings. I know some of the mental health contractors that work in the schools here in Colorado, their caseloads really kind of depend on the contract that they have and who the contract is with. If it's using Medicaid, if it's through some of like the mental health agencies, or if it's actually through the school district. So those can really vary, anywhere from like 20 to 50 students, but the frequency in which they see those students can obviously all vary. So again, it really just depends on how big is the caseload for clinical mental health counselors. It really just depends on the type of service and the setting.
Thanks, Ashley. And so you'll hear us say a lot. It depends in this presentation. And so I'll say the same thing about school counselors. So our professional association, which is the American School Counselor Association, has a recommended ratio of 1 school counselor for every 250 students. And I say that, and I wish that that was the truth, but the truth is, at least here in Pennsylvania, that's the ideal, and that's what we strive for. But unfortunately, we don't see that here in Pennsylvania and in many other states. It's not uncommon for school counselors to have over 500 students in a building. I know when I practiced as a school counselor, I had a little over 500 students in my building. And at that time, that wasn't even the worst, because I had some colleagues and some friends in other school districts that were split across 3 different buildings and had 1,000 students on their caseload and would cycle through different days of the week, be in different buildings. And that's extremely challenging, as you can imagine, because students never are quite sure, are you there? And even if it's a day that you're supposed to be in that building, there's a crisis in the other building that you're assigned to. So, you're moving to that other building to attend to that crisis. And when I practiced as a school counselor, I was just in one building, and I was fortunate, and I did have double the recommended ratio, but it was, at least I was in that building all the time and was, present for students. So I would say that that's one of the things that the profession of school counseling really struggles with, are those caseloads. And how do we address this mental health crisis that we're finding? Because now more than ever, our students are presenting with mental health needs, yet we are stretched thin. And I know, at least in the school counseling program here at Commonwealth, we have so many of our students who are under emergency certificates, who are working in Pennsylvania public schools, who aren't quite yet certified, because there is this need, and school districts are recognizing that impact that mental health has on their academic development, on their social emotional development, and on their choices, oftentimes, that they make what they're going to do post high school. And so all of those are related. And although we look at them as, 3 separate domain areas, we know that they're intricately connected to each other. And students very rarely have one issue that doesn't impact other issues. And I would say that that's true in clinical mental health. You have the presenting issue, but oftentimes it spills out into other areas of life.
So areas that,
yeah, go ahead, Ashley. So we'll talk a little bit about what we're seeing.
and also, just to reference the chat, Abby, I saw what you had wrote in the chat regarding your experience and the numbers that continue to rise in situations and the concerns of technology associated. Was there anything you wanted to share regarding that? As I was previewing what you wrote, the numbers are high. And is that in the experience of mental health counseling or school counseling?
I'm sorry, Ashley, I was just going through the chat here for a second. Yeah, go ahead.
Yeah, so I had scrolled up and saw Abby's post on just the rise in rates of suicide
Yes.
and hospitalizations, and the influence of also COVID and technology on children interactions throughout the time frame. And I would say that's part of some of the things that I see in my clinical and mental health setting, just the rise in suicidality, struggles with social media, in addition to some of the bullet points that we had in the PowerPoint. I didn't know if Abby wanted to share any further content on what she wrote.
Yeah, Abby, anything? So I'll just share that I think in schools, we're also seeing that. Absolutely. Students who are struggling with substance abuse issues now more than ever. Social media is huge, where I know some of the big controversy that's happening in school districts right now is, having cell phones versus not having cell phones. My interns are telling me there's a lot of upset over that. Some schools just taking the no cell phone policy. It's a distraction. And so, that really speaks to that social media component. And saying students can't focus on what they need to do during their academic day because they're, checking their Instagram and Snapchat and all that other, things that are major distractions for them. So it's really hard to focus on that academic piece. And thank you for some of the other, I was going through some of the chats, and Lisa had mentioned about corrections and how the caseloads are similar to those. And yes, it's really, really hard. Those are, Stephanie mentioned, they're both extremely vulnerable populations. And that is absolutely true. And some of those recommendations are unrealistic, as Stephanie mentioned, they're unrealistic. And that makes it very difficult, is, so the things that we're being asked to do, regardless of profession, oftentimes are get in the way of, what we're supposed to be doing and what we're asked to do. I know that that's a significant concern, at least with school counselors, is, some of my interns say, well, the ASCA model says I shouldn't be writing 504 plans, but here I am writing 504 plans. And so we struggle with what they're supposed to be doing and what the school district needs them to do. So I think that's an area that I would say that we're seeing specifically with school counseling. But we'll address kind of clinical mental health and what we're seeing in that as well.
So in clinical and mental health, we're seeing interactions of bullying, instances where it's in multiple settings, the school setting itself, but also in personal lifestyles. We're looking at how do we collaborate on building change to those types of interactions, or clients coming to us with emotional stressors related to the standardization of testing, the pressures of society that's being placed on them to perform, to meet a certain standard, to get into college, to move on to the workforce, just the emotional stressor and burden that they might be experiencing. And again, both in the clinical and social settings.
I thought it was really interesting, Ashley, as we were preparing for this presentation, Ashley Hirschberger had shared with me how she's getting those students saying that they're so worried about this push for testing and standardized testing. And we're also seeing that at the school level where students are coming in and they're going to the school nurse because there's such pressure for them to perform on, these standardized tests, and the teachers, it's high stakes for them. And parents are calling and saying, my child said they're not going to move to the next grade level if they don't pass this test. And I said, okay, that's not true, but I understand why teachers, they're trying to motivate students. And so it's really hard. It's really creating a lot of anxiety. We're seeing a lot of anxiety in the schools. We're seeing a lot of depression in schools. They usually go hand in hand, oftentimes anxiety and depression. So, definitely, bullying is certainly an issue as well that we're seeing across settings. And some of that has to do and is fed by social media and things that are happening outside of the school day that students are bringing in, things that are occurring on social media. And then the one thing that I'll say under the what we're seeing category is using social workers versus school counselors, which is really interesting. And I don't know if clinical mental health is seeing this as well, but in Pennsylvania, at least, the Pennsylvania Department of Education established a school social worker certification, which is in some ways stepping on some toes of the certified school counselor, because school districts are not necessarily understanding how their roles are different. And if you look on our department website and read the job description, they're eerily similar. So, any person would go on and say, well, I can hire a school counselor, I can hire a school social worker, which one should I do? And so I think that's an area that we're also seeing is how are they different and how are they the same? And some school districts are employing both, is what I'm seeing, where there is a school social worker and there is a school counselor. Some districts are also employing a school clinical mental health counselor, which is exciting too. And, just definitely like that role definition is sometimes clouded in terms of what does one person do, what does another person not do. So I would say that that's also something that is sort of muddying the waters a bit.
I'm sorry, guys, I lost my screen and I couldn't unmute myself when you called me in earlier, but I was just gonna reemphasize what you were saying. And I'm now in private practice, but when I was working crisis, I thought it was interesting that the data is actually on trend with the crisis that was already happening before COVID. Everyone wants to blame COVID, and I think that it did definitely not help things, but I think also it was a great, I don't want to say blessing, but for lack of a better word, and shedding light on an issue that people weren't necessarily paying attention to. But also I think it's making us come up with different resources and ideas on how to fix it. And so you're seeing schools now actually making kids lock up their phones during the day and stuff. It's starting to happen. So anyways, I was going to share.
Thank you, Abby. Appreciate you sharing.
I see a lot of dialogue going on in the chat, which is great to see the input. Some of the things that you guys are mentioning in here will be futuristic points in our conversation. So hang on to some of those ideas as well, because they're great. They're valid points to bring up. One of the things that I wanted to bring up was the research that kind of helped back this presentation today. So we're looking at the idea of children experiencing behavioral, mental health, or developmental concerns. And at this point, it was 30%. In 2024, it came up to 30%. Think about how many students that would be in a classroom setting. 30% of students are experiencing some sort of challenge. And when Julie mentions the standardized number of students to work with, that seems so challenging to try to be able to implement something to help. So we're looking at 30% of school-age children. And then we're also looking at an estimated of 46.6 million children. At least one mental health disorder is presented in 16.5%. So the data that is saying, you know, hey, we need to look at this. We need to focus on how can we benefit children? How can we make a societal change here in order to work with one another? And that's where I think the work between school counselors and mental health counselors can really reinforce a change. As Julie was sharing in her experience, she's the forefront because she gets to see it based on teachers' interactions, the children's interactions. I don't get to see it in my clinical practice until it's a larger scale concern and it's brought to us. So later we're going to discuss some areas of, you know, how can we continue to make this positive change for society to meet the needs of students, children, not just students. Stephanie, a clinician should not be bearing the burden of a broken system. Yeah, I mean, it's a challenge to look at and to say the mental health treatment of students, the prevalence of children who did not receive mental health treatment that were in need. And again, this is just one study, 49.4%, that's almost half. And to say that someone didn't receive a service, what is that going to do for their future? How is that going to influence their growth, their futuristic plans? When we look at the school counselors and the willingness to collaborate between teams, and that's not just with a therapist independently, that can be a variety of interdisciplinary opportunities. It was there. The interaction and the want to make a change was present, which is wonderful. And research is indicating that unmet mental and physical health needs of adolescents transitions into poor health outcomes for adults and lower qualities of life. So this is looking at that, as Julie had mentioned, the K to 16, we're looking at those 12, 16 and up portions of education and lifestyles. When we think about what is available, how our interactions can make a difference. Your plans as clinical and mental health counselors moving forward are the types of work that we're looking at. I strive to work with my clients on building a quality of life that they want. So again, trying to identify how we can kind of help meet some of those needs, not just mentally, but also those physical health outcomes that you might see, the body responses, the conditions that are associated at times with mental health really stand out. So just a little bit of research to help bring some light into the work that we do.
And that's a really good point, Ashley, where we're really looking at preparing students K through 12 to be working adults, you know, high functioning working adults. And that, you know, it's like building a house. I say, you know, if you don't have strong foundations at those primary grade levels, you know, you're going to see students suffer at middle school levels and then high school levels, and as they transition into adults. And so that's why it's so important that we look at this from a developmental perspective and say, you know, people, you know, might not just typically develop a mental health concern when they're, you know, a little older, that oftentimes there's things that are happening in someone's life much younger. And if we can intervene, whether that's through a school counseling perspective or through a clinical mental health counseling perspective, that individual will fare better in the long run, longitudinally, because of that intervention, that earlier intervention.
Keep seeing notifications in the chat, guys. I'm just looking at
Ashley's, you're so good. Look, checking out the chat. That's great.
we have a lot of great comments to address.
I know. Yeah, I was keeping up with it. I'm like, wow, there's so much good. And I think we'll have some room for some discussion here soon. So hopefully some of you will feel comfortable to unmic and share some of that. So we've already talked and you've shared a lot in the chat box, at least what I can keep up with so far, about different barriers that exist for some of these services. So we're going to look at both clinical mental health and school counseling. So one of those is affordability, and I don't think that this is any surprise. We think about affordability for medical, you know, healthcare services. The same thing goes for mental health services. This can be a major major words today, major barrier for clients and students and kids to receive counseling services. Typically speaking, clinical mental health counselors, we accept either insurance, cash, we may offer a sliding scale, or even pro bono. But that doesn't necessarily mean that those are kiddos who need those counseling services, that their families can always afford the services. For example, someone may not have medical insurance, but they may not also be able to find someone that does a sliding scale that they can afford, or maybe they can't find a mental health counselor who can do pro bono services. Often counselors who do pro bono services, we often have to limit those, not only to make a livable wage, but also to focus on our own self-care and our own well-being. Another barrier when I think about affordability and clinical mental health counseling services is telemental health. So while this can help remove a lot of barriers for folks who's not able maybe to get somewhere in person, the affordability of having high-speed internet or a computer that works or a phone, that can also be a barrier. I think about parents who stay at home with their kiddos. They may not be able to get the privacy that they need to be able to even do telemental health. Or they may be juggling, right, their kiddos at home so they can still get those counseling services. So just for some of these reasons, that's why affordability for mental health counseling is preventing some of our kiddos from getting the services that they need.
And I think from a school counseling perspective, to stay within that affordability piece, we know school districts are struggling. They have limited budgets. They need to hire lots of different professionals to make that school run. And oftentimes school counselors may not be a priority in that budget. So they are forced to stretch themselves thin with high caseloads. In addition to that, oftentimes, our students are presenting with mental health concerns, but school counselors who may have been trained years and years ago, our roots are in vocational guidance, saying that we help students enter the world of work and college and a career. But now we know we're a little more progressive than we were many years ago. And now we know that, yes, that's true, we do, but there's a lot more in those PK, pre-kindergarten through 12 years, that we are also focusing on, and not just that college and career piece. So I think that that's an area too, where, some school counselors who have been trained many years ago may say, I'm not a mental health counselor, refer it out, and then the student is faced with, well, I can't afford it, or, I can't find anyone. There's a waiting list, of several months, or, some of those other issues.
And those issues that even Julie and Ashley are mentioning here, we're looking at the next step of availability. For each provider, what does that look like? And in clinical and mental health counseling, does a provider have openings? Are there providers in your area? If they have openings, what time of day are those sessions going to be offered? Can I pull my kiddo out of school? Can I work with a college age student who is juggling around their course schedules? And just the amount of providers in the area is really vary. I'm in rural Pennsylvania as an example, and there are providers in the area, but it goes hand in hand with the affordability component too. And we're looking at what type of insurances we work with, what type of resources we have, and it's very limited. You get a lot of phone calls for a lot of clients, and it's very hard to find the appropriate time frame, the appropriate just openings for clients. So it's something to really consider of in clinical and mental health counseling. What does that look like? And is it inpatient services where we have beds available and we don't have beds available? Just other areas to consider.
And in terms of school counseling, one of the tragedies is that school counselors are not mandated in several states. Pennsylvania is one of them. We are the only state in Pennsylvania. Pennsylvania is the only state that doesn't have a mandated comprehensive school counseling program or mandated school counselors. All the other states have either one or the other. And so that's really unfortunate. And we really are lobbying to try to get Pennsylvania similar to other states. But in that same vein, oftentimes school counselors are tasked with administrative responsibilities. The principal's out for the day, so school counselor, you're in charge. Or we have a teaching crisis, a teacher shortage, and that's a crisis as well. And so school counselors are saying, we don't have coverage for second grade. We need you to go down there and cover until we can find a sub. So all of those things are pulling them away from doing individual counseling, group counseling, guidance lessons, the things that they're trained to do, they're not able to do simply because they're pulled in many different directions.
Yeah, so we talked about affordability, availability, and also looking at accommodation. So there's a lot of different types of settings and practices that offer evening and weekend hours, but often those can be limited. And so even getting kiddos, when Ashley was talking, being pulled out of school, I just think about the response or what I would see when I was in a school, some of those kiddos being pulled out and driven, to a practice or an agency, then they're missing that classroom time. And they're missing that information. And many of those kiddos who are struggling with some of the mental health concerns, they're also struggling academically. So it can be really difficult, even if a parent can take off work and get their kiddo, to see a counselor. I think that can be a challenge. But it can also be a challenge, are there enough openings in the evenings and the weekends while, counselors are also trying to spend time with their families and practice their own self-care and well-being. So location can also be a barrier because not everyone has reliable transportation. There may not always be a provider in the area. And so I think that's especially true maybe for folks who live more remotely. Thankfully we've grown a lot with telemental health, but like I mentioned before, not everyone can access telemental health due to the cost of high-speed internet, the software needed to use that as well. Another barrier that relates to accommodations is also finding someone that specializes in a particular type of treatment or mental health diagnoses, or maybe that uses a specific modality. That can also be a barrier to try to identify and get a kiddo to counseling services, again, especially if they live remotely. And then lastly, I mentioned this before, pro bono services, for some of those folks who really need it because of the affordability piece. Again, a lot of us counselors, most of my supervisees, they offer a certain limit of pro bono services, but they have to limit it because they also have to have a livable wage, but then also really practice self-care for themselves. So those are just a few accommodation challenges.
And for school counseling, we're really limited to that 8 to 4 workday typically. That's where our students are present and with us. And so we're limited in the opportunities to work with families outside of that school setting. And so we can refer them, but there's often wait lists, as we talked about. Wait lists not only for outside counseling services, but even within the school, if we notice academic difficulties, oftentimes school psychologists, there's also a really high need for them. So students are on waiting almost half the school year to be identified for specialized services or specially designed instruction. And that makes it really hard to, whether that's behavioral or emotional or an academic challenge. We also have a large number of students who are English language learners, and that can, pose difficulties as well. So if a student needs to meet with a counselor who is bilingual or something, that again is further limiting if there's someone in the community that can't work with that family. So we'll move on to acceptability next, and we'll talk about clinical mental health counseling and insurance coverage.
So when we're looking at insurance coverage, that really varies again based on the setting, depending on the work that you do. Are you an agency that is paneled and engaged with Medicare and Medicaid services? Are you an independent provider that's looking at the third-party coverage and paneled with Blue Cross Blue Shield, Geisinger, these independent commercial practices of insurance? So the acceptability for the provider itself also informs us of how are we going to get paid for the services that we're putting out there. Are we self-pay? And also looking at provider preferences as far as engagement and treatment, what type of clients we're willing to work with. And I do apologize, guys. I see we have a lot of dialogue in the chat, but it's also getting very close to our time. So I'm going to keep my acceptability portion short.
Yeah, we have a couple more slides to move through here. So, and I'll just say in terms of acceptability for school counseling that we accept all students. Typically, if you're working as a school counselor in a public school, there is no, well, you're not a fit for this building or you're not a fit for this school district. So we do accept all of them, but unfortunately in accepting all of them, we don't always have the resources to give them. And so, that is very difficult. If they need specially designed instruction or they're English language learners and we don't really offer those services, or they're offered in a really limited way, that can be hard. Also, parents, when we do make referrals, they might yes you in the meeting and say, I'm going to do all these things. And then in reality, they actually don't go out and make that phone call or make that, connection with a mental health provider. So there's risk involved when you send them out. We don't know if they're actually going to follow through with that.
And I know
So-
we're out of time. Did we want to hand it off real quick? Caitlin, I know your slide is at the end. Can we give her a few moments?
Sure,
And then
yeah, and
hopefully we'll have a couple
yeah.
minutes as well.
Absolutely. Yeah, we can go to, so Caitlin, I believe these two are, well, we could maybe ask the questions at the end. Is that what we want to do? And we'll let Caitlin take this slide and then we'll go back to some of the questions that many of you have been talking about in the chat.
This is really cool. I love everything that everybody's been saying, as well as Dr. Hirschberger, Dr. Cerrito, and Dr. Paycheck. And this is actually a research project that I started under Dr. Pytel, who's also a faculty member in the CMHC program. And this is on college and career readiness curriculum as an example of collaboration between CMHC and school counselors. So recent studies have shown that counselor-delivered college and career readiness curriculum helps better prepare students for college program or entry-level employment. I've researched specifically 5 different curriculum programs, and these are over the course of 5 weeks, sometimes 8 weeks, sometimes 9. They're all different because there's no standardization yet for these curriculum programs. But what it is you're having trained clinical mental health counselors or school counselors as well go into the classroom every single day for a 45-minute, 50-minute period. And there's different units that they go over each day between post-secondary preparedness and introducing students to different career options, especially with a regional or cultural focus. So what kind of jobs are going to be available once you graduate? What's going to be out there for you when you're past the P12 system? And there's also a unit bringing in the clinical mental health side with identity, exploring more about your identity, self-efficacy, exploring more about interpersonal relationships. And the nice thing about these curriculum programs is that you get to see the student as the professional every single day. So you get to see different behavioral issues that may be arising, and you get to see them happen in real time. So having these curriculum programs allows clinical mental health counselors to have more data on what students are actually dealing with. And this data can be reported back to the school counselor. So the school counselor maybe is not able to be in every single classroom all day long. But this way you have someone in the classroom with that student and you're able to quickly make referrals, quickly identify issues, because the faster that you identify an issue with a student, the quicker you can help them get on a better path to success. And then analyzing variables of self-efficacy and post-secondary preparedness will help further determine the effectiveness of these curriculum programs. These are still research projects happening across the country in various states. Specifically, there's one in Appalachian youth, or Appalachian, wherever you're from in the country. And specifically, I like Appalachian, but I did grow up in Pennsylvania. And there's a specific study more tailored to foster youth as well. There's also the Bridge to Employment program, which has been around since 1992. So we've had resources like this for many, many years, but we haven't been connected, and they haven't been connecting to one another. So if we're able to tie these together and continue researching variables like self-efficacy and post-secondary preparedness, that is a quantifiable way that we can determine if these programs are successful. And so far, we've seen great success with these. And also incorporating standardized CCR instruments and performance tests would allow school counselors to better gauge gaps in support and would align with the ACA's movement toward national consistency. So like Dr. Cerrito said, school counselors are under the ASCA, I believe, I apologize. And as clinical mental health counselors, or as a student, we operate under the American Counseling Association. And the American Counseling Association is moving toward the Counseling Compact, where states are agreeing to make services more accessible to people across the country in regard to moving and all sorts of things. So if we were able to have more standardized instruments that would not only provide this education, post-secondary preparedness to students and manage behavioral issues in real time, we could also set up a long-term plan to help American kids continue, because that's another issue with making sure our kids are continuing to be competitive on the global stage. So that's just one example of collaboration that I've seen in research, and it's really interesting to me. And that's my fifth baby. It's not a real one, just a research project, but thank you.
Thank you so much, Caitlin. And thank you for sharing a little bit about that exciting research that you're doing. We look forward to hearing more about it. All right, so I'm cognizant of time here, folks, and I know some of you have lunch and other things waiting for you, and you put some wonderful things in the chat. So I'm just trying to think of how we want to go about maybe just ask some questions, if we have a few minutes to ask some questions. And I have a few kind of prompts here that we have that we weren't able to get here, but I think a lot of you in the chat were on the right track with talking about how to better collaborate. What are some services that are missing? You know, what are the challenges? Certainly there's so many of them, and how can we collaborate better? So maybe we can just, in the last few minutes, we're technically out of time, but I'll just ask, does anyone have any questions or anything that they want to share that they weren't able to put in the chat?
I have a feeling, Julie, we could probably stay on for much more than a couple minutes, and definitely more than an hour, just looking at the chat box. I think there's been a lot of great points brought up, a lot of questions, maybe some things that we don't even have, we don't have answers to quite yet.
Sure.
But definitely great dialogue in that chat box too.
Yeah, and thank you all for, your willingness to engage with each other in the chat while we were presenting, because there certainly is so much information here. And we really are, I believe, in the infantile stages of recognizing how, these professionals can better serve our, we'll say, K through 16 student population and even beyond, into those adult years. Certainly there's things that we can do to better collaborate. And I'll say one of the things that, again, Ashley H and Ashley P and I were speaking about is, even in the training, in the counselor, training of school counselors and clinical mental health counselors, I know we do some things where clinical counselors serve as the counselors for clients who are school counselors. And there's some ways that they can interact with each other to learn a little bit more about those two different roles, because chances are that they'll need to know about that if they're going to look at serving individuals holistically. So thank you all for your attention. I'll stay on for a little bit if anyone has individual questions. Certainly some things to ponder here. We appreciate, this was a great size audience. We appreciate all the things coming through the chat that you were talking about. And we hope you have a great rest of the conference today and a wonderful upcoming weekend.
Yes, thank you, everyone.
Thank you, everyone.
And Julie, I have to skedaddle. I'm a Zoom room monitor in 2 minutes. So
I know.
y'all have a
Sounds
great
good.
day.
It's a busy day. Okay,
I
thanks,
know.
Ashley.
Yeah.
He may have become, well, I don't know.